So today we're joined by Dr. Dylan Cole, Chief Medical Officer at the Moab Regional Hospital, to learn about what this means for residents in these small towns. The hospital recently sent a letter to Utah Governor Gary Herbert urging him to close recreational and hospitality services, including national parks, if within his power, before coronavirus sweeps through the community. Dr. Cole, thank you so much for joining us. Can you tell us about the rationale behind the call to close national parks?
Absolutely. Thank you for having me, first off, Olivia. And I'm happy to be here and to be able to help spread what I think is a really important message. Um, what I think we need to understand that's a challenge to understand is the unique public health and infection prevention challenges that this particular virus and this particular pandemic presents. I will go, a little later into some of the specifics, but just to introduce the concern, the challenge is that what we've come to know in our short time studying and trying to respond to this crisis, this virus can be passed many times by asymptomatic individuals who really have no knowledge of their own infectious potential. The virus also hits people differently in terms of severity and in terms of disease presentation across the age spectrum, yet we're all susceptible hosts. In other words, we believe, really very little immunity within the population to the effects of this virus. That combination of just so many susceptible hosts, as well as what we're coming to call silent spreaders, or individuals that further spread the virus without having symptoms themselves, creates really substantial public health challenges. People coming to areas, gateway areas like Moab, in order to distance themselves and recreate and get out into the outdoors, I can completely understand. And I do understand why people would want to do that. The challenges are that in the process of doing so, people do come together at common shared spaces, whether that is the gas stations to fuel up your vehicle, whether that's the grocery store to stock up on groceries for the trip, and other spaces like the facilities and the bathrooms within the national parks. And furthermore, the more people that are using these spaces, the more that our own residents who work to stock the grocery shelves and who work to attend and manage the gas stations and clean the facilities of the parks and the campgrounds are themselves put at increased risk. So those are some of the specific challenges with this particular virus, in which this creates a really strong public health threat for small communities. We can talk a little bit about some of the projections and modeling numbers that we've done for Moab itself. And I would say that, specifically just for our service area of 10,000 people, not considering the potential influx of visitors, the projections are really quite alarming and quite concerning in terms of our ability to meet the community's need. So at this point, we felt it was important to take action to get the message out that well-intentioned outdoor enthusiasts may inadvertently be introducing this virus into communities that could truly be overwhelmed in a devastating way by its effect.
Thank you for sharing about some of these challenges. That's heavy stuff that I hope a lot of young people will especially really get behind, because I feel like the general sort of sense that young people get is, oh, this isn't necessarily going to affect me. And I especially have a lot of friends who have been working at ski resorts or in fine dining. And, these are the same people who are out of job and now see this as a moment to um, go spend some time outside, get away from all of the really negative media for a minute, and by getting out onto public lands. Um, and so, what would you like? How would you message this to a young person right now who might not have a job and who might think that going out to our public land where they don't necessarily need to be close to a whole bunch of people and where they might not crowd um, is a good idea? What would you say to them?
Absolutely. I think that's a really important question. I think what our message is to people is that we do recommend, and I certainly would encourage people to continue to pursue those activities that they can do alone without a lot of close gathering together, and that they can do close to their home base, so to speak. We've seen, as you mentioned, ski communities. We've certainly seen the effects of coronavirus already really hit the Front Range hard. Colorado is in the midst of a pretty significant upswing in the overall numbers of infection, and those numbers really started to climb first in the ski towns, in the tourist communities that likely directly as a result of that intermingling of people from all over. Our hope at this point is really to prevent the spread. And, while I understand that, it may seem like a good idea to get out of a crowded city and to head out into the wilder spaces, it truly is our request because of the effect it could present in asymptomatic people bringing the virus with them to these little communities where our medical infrastructure is just so minimal. We run a 17-bed critical access hospital. I'm a family physician and practice obstetrics as well. Our entire medical staff, including our physician staff, as well as our mid-level practitioners like nurse practitioners and PAs, constitutes about 25 individuals. And we have no intensive care unit and really no subspecialty internal medicine care like pulmonologists. So the effects of a disease in which the fragile portions of the community will experience really alarming rates of hospitalization and of need for critical care support, we just wouldn't be able to meet that need. Right now, our only tool, our most powerful and our only tool is prevention, and is and prevention in the form of social distancing. So I strongly encourage people to get what they need in activities they can do close to home to prevent increasing the rate of transmission of this virus into small communities that may as of yet not seen a significant upswing. Our health department did make a very commendable decision in the Southeast Utah district in which Moab sits, and they did put a moratorium on lodging and camping, and that has helped. We have seen a significant slowdown in the number of visitors and tourists to this community, which I think has helped to, as of yet, prevent seeing a real uptick in our numbers. I am concerned, though, quite so, because our surrounding communities, including our nearest tertiary care hospital to which we refer patients who are critically ill, they are seeing a real surge right now as we speak. And I worry that in a number of days or weeks, they will be at capacity and will really no longer be able to accept transfers of critical patients, which will put us in that difficult situation. We are strategizing and we're working to implement a critical care program here to be able to run a small intensive care unit, a number of beds. But I will tell you that if we look at the modeling numbers, it's really quite dramatic and quite frightening that it really may not meet the need. The most important thing we can do right now is really prevent the spread throughout the country and also within the community by these social distancing strategies. So what sort of things can we do? Well, we can hike, certainly. We can do those activities that have generally lower risk and that we can do by ourselves or with a family member. Certainly at this point, families that are living together and living in close quarters should continue to recreate together as well. But we've messaged to our own community that we do recommend avoiding some of our favorite activities that we normally do with friends, like mountain biking in a group or rock climbing together. Can I just mention a couple of the other specific aspects of this virus that make transmission really so difficult to stop?
Yes.
One of those is that I mentioned already the concept of the silent spreader. Our estimates are that there's a significant number of individuals that may truly not show symptoms of the disease, and in those individuals, they've found that they've tested, in areas and in countries where they've tested widely, they've found a certain number that truly have no symptoms, but are harboring a large volume or a large amount of the virus, and they are in fact able to transmit that through their own respiratory secretions, nasal secretions and coughing and that sort of thing. And those individuals, of course, have no way to know that they're in fact putting others at risk. In addition to that, for those that do show symptoms, sometimes in young people, the symptoms may be that of a severe cold or a flu. But again, you may have the ability to transmit this virus for up to a few days before your symptoms start. So similarly, a lot of the kind of travel that I think puts people at risk is not by the young person with a fever and a cough who decides they're going to disregard the warnings and go out and socialize anyways. A lot of this is because well-intentioned individuals who would certainly isolate themselves if they knew they were contagious just have no way to realize, because they're transmitting and spreading the virus before they show any sort of symptoms. And then the other characteristic that really came out of a New England Journal of Medicine article this last week shows that the durability of this virus on a variety of surfaces, it's pretty remarkable. We've seen that on stainless steel and plastics, the virus seems to be able to survive for up to 72 hours. That's 3 days. That means that gas pump that you use to refill, in a little roadside stop might have still contained virus that someone transmitted to it 2 days prior. That's really remarkable and helps to sort of see why transmission may be difficult to slow down. Cardboards and porous materials, the virus seems to be able to live up to 24 hours or so. So what we're messaging to people certainly is that really any surface in common and public spaces, at the grocery store, at the gas station, in the bathrooms, etc., all these surfaces have the potential to hold virus, and we really need to interact with those spaces and those surfaces as a possible risk.
Okay, Dr. Cole, thank you so very much. You've given us a lot to chew on, and hopefully our members a lot to think about if the days start getting sunny after this weekend and the itch to go outside really takes hold. So I appreciate everything that you have to say. Is there any last thing that you wanted to add that you didn't yet?
No, I think that, I encourage people to find those outlets that they can close to home to still get we all need in this time of stress and this is a challenging time for everyone. We all need to find those ways that we recalibrate and we rebalance and we reset our own nervous systems. And so I do encourage people to find ways to exercise close to home.